About 3 years.
3
4
years.
years.
You runner?
Yep.
Mid portion Achilles.
Do you still run
Has it
on
got
it?
a lump on it, maybe?
No, there's no lump. Yeah, I still run.
So what's your weekly sort of, what can you do?
There? Was that how much?
Well, what can you do now compared to what you used to do?
Well, you used to have to run about 4 times a week, and now I run twice.
Is that the spot there?
Yeah.
So it's thickened.
It's thickened.
And have you had it treated with shockwave?
No,
You
I
got one?
haven't.
Yeah.
Me too scared.
So what have you tried? What have you tried?
I enjoy needling on it, exercise, osteo.
Do you want to get everyone to sort of feel so we can?
Okay, so you've done all your heel lift stuff. Your hanging hand, all your loading.
So you guys come up. Do you mind if people feel you up?
Probably.
Just have to feel the mid portion, so you'll feel the thickening. He doesn't really have a lump per se, but it's
He doesn't have a feel?
Sure.
Oh.
It's not super lumpy, is it? But it's dense. So I've treated some that have had like lumps in it, and so you just ultrasound it from both sides, and it's just half the size. You just can't explain that. It's actually just physically
It's crazy.
dissolving, breaking it down. It's fascinating.
The only ones I couldn't get rid of were those ones that had it for 10 years.
Yeah, but at least if you get it half the size and you make
Okay,
it
everyone-
rollable, even if you can still visualize it, it's more functional.
So, I use the 15 mil. I put gel on both sides. So usually, where the problem tends to be, it tends to be more on the anterior aspect of the Achilles, yeah?
Is
And
there a
it-
reason? Sorry to interrupt. Is there a reason why you keep the knee flexed a little bit?
Because it's easy for me to treat.
Okay. So if you're sitting bottom and you can just lay it like
I just find this is easier.
Okay.
This is just easier. Is this how you do it?
I've got a little pillow actually,
what
so
I
I
was
have
gonna
their thing there, and actually my table's lower,
Yeah.
so I sit on the floor, or I have a little stool as well. I've just got a few different things, but I have
Yeah.
a patient like that and sit down, or I work from a pole.
But I find this also takes some of the tension out of the calf.
You could also do your movement during. If
You would
have
never
it like
treat
that, you
it
could-
loaded?
You could load it.
Yeah, we're gonna get to that.
Yeah.
So we'll try on 1.5. I'm sure he'll be fine with that. That's not very high for an Achilles.
Sometimes they're quite.
So usually the Achilles tends to be worse on medial than lateral. Very few people do I find lateral more painful. Okay, but it also penetrates through. Remember, because it goes 40 millimeters. So some people, when I do the lateral part, they actually feel it more on the medial part. Yeah. So let's start here. What's that out of 10? Oh, you just speak up.
I'll tell you what, 4.
3 or 4. Yeah. What about on this side?
Yeah, 1 or 2.
Yeah. So this is it. So we want them to have more fun while it's here, have an experience. So we'll put it up a bit. What's that now?
6 or 7.
So we hit our sweet spot. We're up to 7. So I'm doing the ironing here. So the beauty with the 15 mil, it just sits in that groove so perfectly. You just sit in that kind of rut in there, and you just go up and down, up and down. Now you can just hold it there, okay? You feel that? Yeah?
Yeah, it's not too bad. Probably might do a bit higher or lower. Yeah, there.
There we go. I was just going to say, I can feel it there. So that's what I'm saying. I can feel with this. I can tell where the spots are. But I've been doing it for 5 years, and I see 5 to 10 people a day, so you do the math. I've seen a few people.
I think you're right, actually.
Feel ladder. Yeah, so that's what I'm saying.
Is there anything with a handpiece you've got to be careful not to do with it, just going to damage the handpiece?
Damage the handpiece.
Is
I
there
wouldn't
anything-
drop it on the ground
Yep.
repetitively or stomp on it. Make sure this is on tight. Okay, if that's a little bit loose, you'll hear it. It'll sound different.
Yeah, it won't connect all the way through because it's sitting up too high.
Does that feel different? Alright? Okay. So make sure that's on tight. Okay? Not crazy tight, but not loose. Okay?
It's like anything, use it over and over, it might get a bit loose. So just a good hand tight before treatment, make sure. I once had someone call me, go, oh, does this...
Make sure you wipe it. Make sure you get the gel off. The gel accumulates a little bit and gets it gunked up. So I'm getting bored. I'm going to crank it up.
Oh, God.
Now, so we got on 20 hertz. So you tell me if this feels different. Better or worse, the same?
A little better.
Yeah, again, a little bit better. And I'm getting the job done faster. So.
I know if you were putting the head through the autoclave periodically if you wanted to.
You can put the tips through, yes. Yeah, not the handle itself, just the tips,
Do
yeah.
you have to take the O-rings out? Or
Yeah, I'll go run that through you guys, with you guys on that. You know,
Put it through the autoclave, did you say?
yeah, if you have an autoclave, you can autoclave the silver bit inside and the rings come off. Yeah, I'll pop by Tukely and give you guys a insert. Have a surf. The yeah, the dark gray outer and the silver part inside. Yep.
That just fully let go. I could just feel his dorsal deflection increase like 5 degrees as soon as that's fully let go. Feel that move more?
Yeah, there's the bottle at the back.
Then we can do the lateral part.
Yeah, the catchment bottle.
yeah.
Gets past a couple centimeters.
Yeah. But here's pretty good, yeah?
No, that's
I think it's a good way
So that's what I'm
of
saying.
he's having it up.
I can't
think
feel
it's a
much
good
here,
way
but
of
he's
doing
saying it
it.
hurts, so I'm going to position it.
Yeah, you can really.
So that's why I'm
Rather
always
than
getting
using
feedback. Yeah? And don't be afraid. You don't look stupid if you keep asking the patient. Most patients will think you're actually being a caring practitioner, right? We all kind of get in our heads, oh, I don't want to ask too many questions because he thinks I'm not. It seems like I don't know what I'm doing. Right? Patients don't usually think that. They usually think he's trying to find the spot, right? Because you're like, help me find the spot. So don't be afraid, and the more you ask, the better you'll treat, because you get more feedback. And then you start to correlate what you feel with the feedback. And then you'll get better at feeling spots, okay? Worst here, though. Worst here, then up here. Worst here. So again, you just asked, am I applying a lot of pressure? I'm not. I'm really just trying to feel. Does it look like I'm pushing hard? No, I'm just.
You can see by the two silver rings on the tip.
Yeah,
you can still
them,
see.
I'm not compressing.
Yeah.
That's compressing. Yeah. Yeah. So you can tell I'm not compressing because you can see those tips.
The rings, yeah.
A little bit there.
Yeah. I haven't tried it. Yeah, it's pretty good. Yeah. What is it?
Okay, hang on. Give me a wipe. Now, we should have tested you before, but
Yeah.
the,
You
so
do.
again,
The
For
knee against the
Achilles,
wall.
I just do those 4 tests, really.
What's the one called against the wall to get the, you know, the heel lifting?
Need a wall.
Need a wall. I think need a wall. Thought there was
It's a hard one
something.
to
Yeah, yeah.
remember.
Thought there was something clinical to say. I guess not. You can see the nice pinkness in the area too.
How's that feel when I do that now?
Yeah, good. Still tender.
It feels a little less thickened, if you guys want to have a feel. Not hugely, but it feels a little like we moved some fluid and stuff out of there. And what you'll notice when you feel the tendon, you can almost feel like your fingers can slide or glide much easier through there. Because remember, we're causing the secretion of lubricant, which lubricates those tendons. Yeah, that's one of the physiological
I know for me it
effects.
took the thickness out big time.
Yeah. Okay, stand up. Walk around. So if you forget, it's all in here. The physiological effects.
Yeah, you recommend, like, if they've come in with their shoes, put their shoes back on to walk, and to get like an apples to apples kind of comparison, or much for muchness?
I usually test them. I usually get them to walk barefoot first,
Yep.
and then I get them to walk after.
That must be the speed that causes the numbers, that overriding of the brain's processing, I think.
Yeah, that's what I'm saying.
Because I don't get a lot of that, but I haven't been going that speed, so that's interesting.
Yeah, it's just how quick.
Yeah.
Because there's too many signals coming at the same time, so they're competing. Right? How's that? Just try doing the single leg. The double leg hop. Single leg hop.
Yeah, feels good.
Yeah. Less tender than before? Yeah.
Just less tension.
Yeah. So again, guys, another effect, because we decrease the pain, we all know that pain has a reciprocal inhibition of muscles, right? That's what he said. Adam said the same thing. He had his grip strength felt like 20% increased, right? Because we've got rid of some of the pain in the forearm, right? Which is now your brain is going, okay, well, I can give you more power, right? When you have pain, it's like having a resistor there. Your brain's going, whoa, whoa, whoa. I'm going to dampen your force production, because if I give you full force production, you might tear that tendon, yeah? Because your brain knows that it's damaged, it's unhealthy, yeah? And same thing here. So a big part of it is, I love to get patients to go and do their exercises afterward, right? Because I want them to reinforce that pain-free motion. I want to get that joint. I want to get that proprioception. I want to get that strength. I want to reinforce that pathway in their brain. Yeah, like you with your toe, I get you to go for a walk. Yeah. So now I get that toe extending and walking, and your mechanics are better. And then we do it again next week, and then you walk further and longer, and it's just reestablishing a new pattern. Yeah.
If Finn's your typical patient, he feels good after he's had the Dolorclast done.
Yeah.
If he goes and runs 20 Ks,
Yeah.
what's going to go? His calf muscle, muscle belly, or is he going to sort of reignite the Achilles? Do you have to rehab the calf muscle as well? Because for the last 5 years he's been getting around with a compromise. Is it 5 years? How long? 3 years he's been getting around with a compromised Achilles.
We're just, what I'm teaching here is more symptom treatment. Yeah. So if he was my patient,
not rehab.
Yeah, if he was my patient, I'd be assessing his foot, ankle, knee, hip, and pelvis, making sure all the mechanics are proper. Yeah.
Yeah.
I never just look at. Again, I do the why. Why is your Achilles having problems? I haven't answered that question. I know your Achilles has a problem, but I haven't answered why. And that's where you got to put on your diagnostician hat, right? You got to figure out why. Why don't you have it in your other Achilles.
Like you definitely wouldn't go run 20 the next couple days. You want to let it, you know, it's
But
but
why
yeah,
do
yeah,
you
yeah.
Reconstruction on that left knee.
Okay. Well, there we go. So he's had some knee problems on the left side.
Mm.
We had a runner who she ran like 100 k's a week, and then she had I can't remember whether it was Achilles or wood, but we treated her with a radial shockwave, and she came in the next day. She called, she was so sore that she felt so good that she went out and ran the next day. And did something else.
Yeah.
And she literally did that because she came back in. This is when we first had the machine. Oh, what's happened? She goes, I felt fantastic.
Yeah.
That's something else.
I've seen that a number of athletes in services like CrossFit guys are like, oh my God, can I go to the gym tonight? Like I feel that much better. I just want to go nuts. Yeah.
You have to be careful with that stuff. Okay. So I like them to go use it, but the caveat is not too much.
Yeah, we're just trying to get heal as well. Yeah, you need time.
Okay. So make sure you tell them that.
Because it takes time for the tissue to heal.